Now it's time for tonight's orthopaedic question time. Please welcome your host, Mr. Jonathan Dimbleby.
When is a resurfacing of a hip a better operation than that of a total hip replacement?
Michael Bichet.
It's a funny operation. Resurfacing was invented, if you like, about 40 years ago. The material was wrong, and they failed it about 7 years. And about 15 years ago, a chap from Birmingham, Derek McMinn, he revived it with new technology, with special metal, and the results have been fantastic. And it caught in England, Europe, and in the States, the world. In UK, 30% have become resurfacing. In men with strong bone, young, active men, they did extremely well. We audited 1,200 patients in Bath, and of those 200 have passed the 10-year mark, and they have fantastic results. But in women, we had a higher revision rate than normal hip replacement. Women don't do very well with resurfacing because their bone tend to be smaller and a little weaker as you get after menopause. Having said that, the advantage hip resurfacing did was it preserved the femoral bone, not the acetabular bone. So even if it lasts 7 years, I'm capable of doing a primary hip afterwards. Indeed, our Sherman have a pair of them he had done in Birmingham, and as you've seen, he's been skipping around happily. So that's not advertisement, but that's only a small statement to people you know, people running in front of you doing very well.
The only downside of them is when you go through airports, you are automatically, you have to say hands up as soon as you go through, and then you try to explain, and if you don't understand their language, they don't understand yours, they look at you with even greater suspicion, and that round thing is, until they find it eventually.
Cled is possibly the most senior in the surgeons here. He wouldn't let his patient go back to play tennis or squash. He wouldn't go running marathons, not on a hip replacement. But on a hip resurfacing, yes, you would.
And I have to say that I have had, my mobility was impaired, and I play tennis quite ferociously with a coach, and I ride horses, and I have more mobility now. I have to say, maybe I'm one of the lucky ones, far more mobility, I'm 68, than I had when I was 40 and I did a lot of sport. It's unbelievable. It feels like having 20-year-old hips. And I see friends and colleagues beginning to stiffen up. I'm sure my back's stiff, but I never have any problem from the hips, nothing at all.
You know, you can have a successful resurfacing, but the problem is it's not guaranteed.
What is guaranteed in life?
I'll give you the facts. So before today...
That's not answering my question.
What I did to justify my argument for this, I've actually gone away and pulled out the data from the National Joint Registry, which is effectively the data of all the hip replacements done in the UK and all the resurfacings. And so, just looking at young active patients, if you have a hip resurfacing, the 8-year survivorship, you'll have a failure rate of over 9%. If you have a standard uncemented hip like I would do, you have a failure rate under 2.5%. So potentially up to 3 to 4 times lower. You know, in my older patients, failure rate is 1.96%, and with 7 years with a form of resurfacing, it's 10.38%. So these are black and white figures, you know.
Okay, audience. Who's in favour of resurfacing? Hands up. Who prefers replacement? Hands up. Who hasn't got a view? Hands up. You are so cautious, you lot.